So let me take you through the marvel that's the human body. Your body itself is a well-tuned machine, and like any engine, it needs the right balance of fuel and care to run smoothly. Now imagine this engine starts to misfire and begins to have an overload of acidity, straining its systems and then slowing it down. That's exactly what happens inside the body of someone living with chronic kidney disease when metabolic acidosis sets in. It's a silent and creeping problem, weakens the muscles, damages the bones, and accelerates every disease it comes with. But here's the key: what you can eat can significantly shift that balance. And the good news, it's easier to adjust your diet than you might think, especially with the foods you already know and love right here in Nigeria. So today, we're exploring what you eat that can help your body fight metabolic acidosis. We'll explore common Nigerian dishes, tweaks that you may need to make according to your recipes, and how you can turn your diet into a tool for healing. Trust me, you want to take notes on this. My name is Dr. Tiwa, and welcome to Dietary Podcast. Chronic kidney disease, or CKD, affects millions of people worldwide, often progressing silent. So managing CKD before it leads to dialysis is crucial for a better quality of life, as protein metabolism becomes an added burden with individuals who have CKD, as it can accelerate progressive decline in kidney functions. How does this happen? Because protein is the source of nitrogen in the waste generated by the kidneys. Interventions that slow down the progression of kidney function decline and delay the initiation of dialysis for patients living with CKD are essential for a better quality of life. Renastal tablets, a breakthrough nutritional therapy that is beneficial for CKD patients. Renastal combines keto analogs and essential amino acids to prevent and manage the damage that results in faulty protein metabolism. Renastal as a tablet, taken with a very low protein diet, helps slow the progression of CKD, thereby reducing the risk of initiation of dialysis. By replacing essential amino acids without adding nitrogen waste, Renastal can help you maintain the protein balance your body needs whilst protecting your kidneys. Renastal, you are not just managing your kidney health, you are improving your long-term well-being. Ask your doctor if Renastal is right for you, because together we can take steps to protect your kidneys and improve your life. Renastal, helping you live better with CKD. For more information, contact the Circle Direct podcast on YouTube. So what exactly is metabolic acidosis in chronic kidney disease? If we break it down, for those with CKD, the kidneys begins to have difficulty getting rid of excess acid. Now the body has what is called like a push and pull mechanism. The more acidic your body feels, the balance is alkaline, trying to make sure it evens out. But when we have CKD, the kidney function declines, allowing the acid to build up in the blood. That's where we say we have metabolic acidosis. It might sound harmless at first, but over time, that acid imbalance begins to weaken the bones, break down your muscles, and then worsens kidney disease itself, leading to increased likelihood of mortality. Now, this is where your diet would come in. By choosing the right foods, either by increasing or decreasing acid in your body, you can influence how well your body deals with this burden. And the real beauty of it is there are a lot of alkaline-rich foods in our landscape today. In most of everyday Nigerian meals, you'd see alkaline-rich foods. Now, what Nigerian foods do we say can help manage acidosis? One of the most powerful ways to manage metabolic acidosis is to incorporate these alkaline-rich foods because they help to neutralize acidic buildup. Many plant-based Nigerian meals are excellent for this purpose. For example, ugu, which in English is called pumpkin leaves. This vegetable, used in soups like edikaikong or egusi, which is very popular in our landscape, are full of nutrients and are naturally alkaline. And you know, egusi and edikaikong are foods that a lot of people enjoy eating. So including these meals, which is already mainstream as it is, would help your body combat acidosis while still enjoying the flavors that these meals provide. Also, let's not forget about yam. Whether you prefer it boiled or pounded like me or fried, it's a high potassium food that can help balance acid. It also manages your potassium intake due to people that have advanced chronic kidney disease. Always consult your dietitian to find the right balance. Another great alkaline option is okra soup, which is draw soup. Okra is rich in nutrients and helps reduce acid levels, making it delicious and kidney friendly. Of course, while adding these kidney friendly meals to your diet, it's equally important to cut back on others that worsen metabolic acidosis, specifically animal based proteins like meat, poultry, fish, which are a huge part of Nigerian cuisine. These meals, however, tend to increase more acid in your body, which is not advisable for anyone living with chronic kidney disease. But not to worry, you don't need to eliminate them completely. Everything that has to do with meals is always done in moderation. So think of portion control. For example, rather than loading your plates with large portions of goat's meat, beef, try to incorporate a lot more plant-based proteins like beans, for instance. Beans are not only versatile from like ewa going to moi moi to ekuru. Ekuru is probably pretty niche because that's more of a southwestern staple, but they very well help to produce less acid, making them a better alternative for chronic kidney disease patients. Another acid forming group to watch out for is processed meals. Processed meals like canned meats, salty snack, and one very popular one, highly processed instant noodles. It is very high in sodium. So this is not good at all for people with chronic kidney disease, and as it contributes to fluid retention and higher blood pressure. Try replacing these meals with foods like granite or garden eggs for snacking, especially because a lot of people engage in instant noodles because it is easy and instant to eat. But you have to look at the flip side of consuming so much of that meal. So replace it with garden eggs or granules or things that at least would help with controlling your sodium intake. But let's not also forget the basics when it comes to a patient living with chronic kidney disease. Hydration. Drinking enough water can help dilute acids, especially in your urine, making it easier for your kidneys to filter and expel them. In Nigeria's hot climate, staying hydrated is very important. However, for chronic kidney disease patients, especially people that are in the advanced stages, having to consult your healthcare provider as to how much you should restrict fluid intake or the levels that you should take per day would be much more beneficial for you. As for you, for a patient living with chronic kidney disease, the right amount of water is needed. Not too much, but not too little. So always follow the advice of a healthcare provider on how much water you should be taking. In other cases, your healthcare provider or your doctor might recommend using sodium bicarbonate supplement to help neutralize acids in your body. Now, sodium bicarbonate is essentially baking soda, so it works by helping to balance your body's pH. But be very cautious. Chronic kidney disease patients have to be careful with the amount of sodium levels they put into their body so as to avoid complications like high blood pressure. So always take supplements under medical guidance. So when it comes to fighting metabolic acidosis in chronic kidney disease, the power of food cannot be understated. By making little changes like adding more alkaline-rich meals, these are meals that people already enjoy. Edikaikong, egusi, yam, okra, these are meals that are mainstream and easy to enjoy. And also reducing the amount of acid-forming foods like processed foods or processed snacks like instant noodles. You are giving your kidneys the support they need. Your body will thank you for it. and that will make your body understand and be fine-tuned better. The road to better kidney health doesn't require huge sacrifices. It's only about making mindful and deliberate choices every day. With a well-planned diet, you can take charge of your health and slow down the progression of chronic kidney disease while still enjoying the delicious meals that Nigeria has to offer. So that's it for today's episode of the Circle Direct podcast. If you found this episode insightful, please share with your friends and family, especially those that you know are living with chronic kidney disease. Let them also understand that living with this condition doesn't mean that they have to completely eliminate all the foods that they previously enjoyed before the diagnosis of chronic kidney disease. Don't forget to subscribe, and if you have any comments for us to go through, please leave them in the comment section below. Stay tuned for more health tips on how to live your best life and be proactive with your health. Until next time, take care of your kidneys, take care of your health, take care of yourself. Bye.